What is PTSD and what are some common symptoms?
PTSD stands for post-traumatic stress disorder. And if a stressful or traumatic event, for example, severe abuse, violence, a severe motor vehicle accident, or disasters are occurring, and it involves a situation where someone's life or safety was threatened or an injury actually happened, then the risk of PTSD can occur. So common symptoms, there are two different categories we usually focus on, is re-experiencing or re-remembering the trauma through intrusive memories. They just kind of remember them, nightmares and dreams, or they just act and feel suddenly like it's happening again. Those are called flashbacks. Another large list of symptoms that could happen is physical and emotional symptoms. So it kind of almost feels like an anxiety attack that comes from PTSD, especially if they're reminded of the event. The losing interest socially could happen, extreme emotional changes like irritability or anger or even sadness. Sleep problem is very common because sometimes it's visiting them during their sleep, these memories and events. And poor focus, and therefore they can't work very well. And a word called hypervigilance, meaning very aware of your surroundings and as if it's going to happen again. And so being vigilant about your own safety, even though it's not being threatened anymore.
When do symptoms of PTSD appear or occur after a traumatic experience?
Now, I would say that most reactions to stressful events sometimes are brief and people recover, without any further problems. Not every traumatic event is going to cause PTSD in people. But severe and catastrophic events that leads to PTSD, it can last for a month or several months, sometimes years. There are some people who have untreated PTSD and still struggle to this day.
How is PTSD diagnosed?
Sometimes it's difficult to diagnose PTSD because it has variable presentations. Some might initially just show irritability and anger. Not everyone who's irritable and angry would be like, oh, you have PTSD. We wouldn't say that, right? And some may act numb and detached. By itself, you don't know if that's PTSD. But amongst all of the ways of diagnosing it, majority of people struggling with PTSD, they will avoid situations and places or anything that reminds them of the original traumatic event. Mental health clinicians, we can try to determine through interviewing, sometimes through drawings and play therapy, especially for children, and sometimes just observing and asking the list of questions that we use as a criteria to determine if they have PTSD.
What typical treatments are available for people with PTSD?
Early intervention is always the best, and I say that quite often because right after a trauma occurred, we really shouldn't wait till, let's see if they have trouble with that later. It's always best to review it and debrief it sooner than later. Then you can actually even prevent the illness of PTSD. But of course, if that didn't happen and someone is experiencing it, to ensure the child or the individual that they are safe, right? Well, let's make sure they are safe and they're not being exposed to the toxic, traumatic environment still. Psychotherapy, which is counseling, it helps to consciously address the trauma and how it can affect the person's life. Some people don't want to talk about it. They just don't want to remember it again. And that triggers them to have more anxiety. But a skilled therapist would know the speed to have that remembered and reprocessed again. Because unless we do that, the subconscious memories will remain and continue to hurt the person. Avoidance, it worsens the situation in the long run. So that's why we're always recommending talk about it. And maybe not all the details all at once, but little by little. The modality of treatment, there are two that are proven to work. One is called CBT, Cognitive Behavioral Therapy, and very specifically, we call that trauma CBT. And another one is called EMDR, Eye Movement Desensitization Reprocessing. A very fancy type of treatment, and these have been proven to be effective even for chronic PTSD, meaning someone has had PTSD for a long time. And then there are medications. Now, medications, it will never remove the memory per se, right? It can't erase the past. But what we do with medications is when there's so much anxiety and paralysis and hypervigilance and sleep problems, or a depression is developing, we use medications in order to give some relief so that they can process their traumas in therapy. So sometimes people get judged when they're taking medications for PTSD, and they just don't, the ones who are judging don't know what it's really given for. And if you are on medications and you know someone who is, we need to encourage them that while they're taking it, are they reviewing their trauma? Are they processing that somewhere? So that's what I would say is important for treatment.
Are there ways a parent or teacher can detect this disorder early on?
So if there are sudden changes in behavior or speech, even relating to others, school problems, emotional problems, physical problems, like suddenly there's a change or shift, then a curiosity should lead to ask the question, did something happen recently? Is there some stress that you're going through? And so that might jumpstart a child to feel comfortable to express something that might have happened. Now, let's not jump to did you get abused? Or did someone touch you? Did you get raped? That's not going to be a good way of letting the child or the individual feel comfortable to start talking about it. They still might be guarded, and so what you can say after that is, you're really acting differently, and I'm concerned that this might be a stress response to something. So that's one way to approach it. I would also say education in advance is helpful. We don't have to wait till a traumatic event happened. I think we can share with people that evil things happen. It can happen to them directly. So if they've ever been abused or hurt, mistreated, and then now they're having a lot of stress, sleep problems, to talk about it with somebody and to bring it to trusted adults and individuals. And also to comfort the child. You don't have to have secrets about things hurting you or causing you fear. You don't have to keep it to yourself. It's safe to tell people that you know love you, and therefore it might encourage them to talk about it.
Some of the symptoms that we might suspect to be similar to PTSD symptoms can also be social anxiety or depression or panic attacks. So how would we know that whatever is causing it or whatever they are saying is causing it is real or imagined?
Oh, that is a very good question. I would say that a lot of the approach is similar. So let's say it was imagined. It didn't really happen. Um, we can still use the concept of you are safe. It's not going to happen again. Not that you want to feel like you're agreeing that it did happen, but there's no convincing of the person. Because if they're having PTSD like symptoms or anxiety, depression, due to what they perceived had happened, and then we're telling the child that didn't happen, so don't feel anxious, that's not going to really help in this situation. So maybe it happened in their imagination, which is very, very scary to think that that can cause PTSD like symptoms. In our professional realm of our clinical practices, we do have to determine if it really did happen, because true diagnosis of PTSD is something that did happen. There was a threat to safety or there was an injury. But there are certain cases where experiencing severe long-term physical illnesses like chronic medical problems that led them to go to the hospitals a lot, that can also lead to PTSD symptoms, and we would diagnose that as PTSD as well.
Can you get PTSD not from direct experience but secondary or indirectly?
That's a great question. That is something that we would have to evaluate before diagnosing and labeling. But there are, for example, we advise not to let young children see the news if it is about disasters or there are reports of deaths and gruesome, horrible injuries and deaths. Sometimes the news doesn't censor that, right? And so parents would have to protect children. And the child, intelligent enough to know that that really happened and witnesses that, sometimes they can develop PTSD like symptoms.
Or perhaps through movies?
Right, that one is an interesting question. If they don't know the difference of reality and not reality, then that is why the movies also have ratings. And so we advise not to watch vivid, graphic movies that deal with hurting people and someone's safety being very threatened.
What can a parent or teacher do when a child is having an actual PTSD episode?
Similar to a panic attack, sometimes the episode will look like they're very agitated, and they're displaying confusion, and they're having a fight flight experience. So when that's occurring, we can ensure the child that they are safe and verbalize that. You're okay, nothing will harm you, you're safe with me, I am here, I'm not going to let anything happen to you. Because what they're thinking is they're re-experiencing it again at that moment if they're having a flashback. And then to remind them, let's take some slow, deep breaths because it's just you and me. And then do the breathing with them, in and out, like the slow breathing. And someone used to share, like, give them a paper bag and they blow it in and out. I don't know where that came from, but I don't really recommend using the paper bag method to do deep breaths because you're about to breathe in your own carbon dioxide. So it's okay to have deep breathing in the fresh air of the room. And another thought I had was if it's safe to do so, meaning that the child won't feel more triggered by touching the child, is maybe hugging or embracing them from behind, not approaching them from the front. Because what if the trigger was they were attacked or someone was chasing them? So If that was the case and you feel like that might be helpful to help them feel more secure, is to tell them, can I hug you from behind or from the side to show you I'm here, I'm protecting you, and speak very softly, okay, not loud and quickly. And then after the storm is over, right, the episode's gone, is to speak calmly and ask, what was going on in your mind? What just happened there? Can you tell me what you were thinking or seeing, in your mind? And then to have that debriefing moment.
What do you suggest a parent do for a child having a PTSD episode in the middle of the night, maybe having a nightmare?
Right. If they are having a nightmare, and if it's safe to wake them up, because there are certain types of nightmares that you really shouldn't touch the patient or the person, is to make them realize that's not the reality and say, you're safe, I'm here, I'll wake up. And it's good to kind of fully wake them up, actually, because if they slip back into that same dream, they're going to experience it again. And for this example, I could even mention to do the nightmare reversal training. And what that is have them verbalize to you or write it down, but what kid wants to write down in the middle of the night? Verbalize to you what the nightmare really was. All the details. Like, tell me about it. What just happened? And they most likely will be willing to tell you. And then you can even tell them, this is what we're going to do the next time you have a nightmare. And then have them repeat the story, but change the ending. So, for example, I was having a nightmare that the robber was coming and stealing our stuff, and they brought in weapons, and they're about to hurt you, and they're about to hurt me. And then they say the whole entire nightmare in detail as it occurred. And then to have them repeat that. But let's change the ending. What do you want to change it to? And let them think of that imagination of the conclusion of that nightmare, that it won't be a nightmare. Okay, well, I thought they were robbers and they're coming, but they were actually friends from the past, and it wasn't guns and bats behind their backs, but they were flowers and balloons, and they were surprising me for a birthday party. So that would be a great way to try to go back to sleep too.
What words of encouragement do you have for one who suffers from PTSD?
Whether it's freshly diagnosed or someone has been experiencing it for many, many years, it is possible to learn to cope and to overcome these negative memories and to not let them overpower your life or your daily activities. Sometimes they take so much control over one's peace or their livelihood, and it is possible to not let that happen again. Because you can't erase the past doesn't mean that it has to rule over your today and your future. I want to also express that it is possible that there is hope to lead healthy lives and a healthy mindset, and to have productivity as you're releasing the chains of the past, because that's what they are. These memories, they're not reoccurring, like they're not really occurring again in life, but the memories are becoming chains, and we can perhaps not erase the memory that it happened, but the chains of how it's affecting someone today. And to continue to suppress or avoid, for example, people use alcohol and drugs, or even busyness of life, other activities, to not remember these events. That doesn't help. Avoidance never helps. And Satan uses past events to keep my mind and my heart stuck there. Right? That's why I use the word chains. Satan does that. He uses what someone did to me or that happened to me, and I can never forgive that. And so, you know, the word forgiveness, and that could be another lecture, but Satan uses that and the justice in your heart to hold on to it. But that's only a prison to keep on living in. That paralysis, that prison, that could lead to hopelessness. And so I want to just help everyone realize how Jesus himself, right, experienced the ultimate trauma, right? The ultimate trauma of leaving his heavenly home and being stuck in a human body, and what trauma to be born in that manger and experiencing horrible weathers and hunger and all the pains that Genesis 3 brought onto this earth, of course, without sinning. And he died, right? All of that trauma just to free me from the bondage of sin and the evil that has been done to me. Because that's what these traumatic events are. Something that was done to me, an injury to me, or threatened my life. And for that, Jesus died. And for that, he will make all things wrong. He will make them right. And at the end of the day, when we're free from this trappedness in our body, the memories in our bodies, the memories in our mind, we will be free from all of that when we enter paradise forever.